Hey guys, so this video is a schematic of chronic leukemia. So chronic leukemia by definition is a proliferation of mature lymphocytes. So the mature lymphocytes could either be mature T cells or they could be B cells that are either naive or mature as inactivated. So mature T cells are going to be CD4 positive. And there are two types of chronic leukemias you can get from T lymphocytes. So you can get adult T cell leukemia / lymphoma, or ATLL, which is due to the human T cell T lymphotrophic virus 1. I hope I said that right. Or you can get mycosis fungoides. So this one here, ATLL, is most common in Japan, West Africa, and the Caribbean, where this virus exists. And you commonly get lytic bone lesions plus a rash. So if you remember, lytic bone lesions are really common in multiple myeloma. You get those lytic lesions in the skull. But for a question, let's say a board exam, if you also have a rash accompanying it, you should consider ATLL in your possible differential. Mycosis fungoides has nothing to do with fungi, unfortunately. It's an infiltration of this T cell leukemia into your skin, and that results in rashes, plaques, and nodules. So far we're getting a rash pattern here. This one specifically has rashes, plaques, and nodules. And those aggregates are called Potrier microabscesses. I am sure I said that wrong. But if those microabscesses start to involve the blood, you get what's known as Sézary syndrome. In Sézary syndrome, you're going to have cerebriform nuclei. So all that means is cerebri, brain. So they kind of look brainy, like, let's see. So they're kind of gonna have like all these lobule looking things, right? And then you're gonna have clear, slightly less dark cytoplasm. Okay, so that's it for the T cell leukemias. And the B cell leukemias, if you have a proliferation of naive B cells, you're going to get chronic lymphocytic leukemia. This is the most common leukemia overall. And you're going to have CD5 and CD20 positive cells. You're going to have increased lymphocytes, obviously, and increased smudge cells. And smudge cells are exactly what they sound like. They're cells with like all these dispersed kind of nuclei looking things, and they look like that. And you're going to have involvement of your lymph nodes. And if you have, or sometimes you're going to have involvement of your lymph nodes. If you do, it's going to be called small lymphocytic leukemia. Excuse me. Lymphoma because it's a mass in your lymph nodes, right? So anytime you have a mass, it's going to be a lymphoma. Let my mistake teach you. So you can have 3 different complications from this. You can have autoimmune hemolytic anemia. You can have decreased IgG, which predisposes to infection. The decreased IgG is because these are naive B cells. They're not producing, these are naive B cells. They're not producing plasma cells. So you're not going to get plasma cells producing IgG, so you'll have lowered IgG, which predisposes to infection. Another complication of chronic lymphocytic leukemia, again the B cell, the naive B cell one, is you can have a Richter transformation, and all that means is you produce a diffuse large B cell lymphoma. So you're going to have big lymph nodes or big spleen. So remember, if you have involvement of your lymph nodes, you're either going to have diffuse large B-cell lymphoma or small lymphocytic lymphoma, depending on if you have that Richter transformation. A proliferation of mature B cells is going to produce hairy cell leukemia. It's called hairy cell because the cells look hairy. So they're going to have these spindly processes on the edges of the cytoplasm. They're going to be positive for TRAP, T-R-A-P, which stands for tartrate resistant acid phosphatase. So you're going to have hairy cell accumulation in the red pulp of your spleen. That's going to lead to splenomegaly. And you're going to have marrow-fibrosis. They're going to get trapped in your bone marrow. And because you have marrow-fibrosis, the hairy cells can't travel to your lymph nodes, so your lymph nodes are not going to be large with hairy cell leukemia. And this is usually treated with cladribine, which is an adenosine deaminase inhibitor. So it inhibits the deamination of adenosine. So you're going to have the adenosine accumulation to toxic levels in these B cells, which will kill them off. So maybe you can think clad in a hairy cloak. I don't know, whatever helps you. So that was the schematic for chronic leukemias. Next, I'm going to be doing myeloproliferative disorders. Thanks. Let me know if you find any mistakes.